Hi, this is Greg Ehlers, and we're back with the Einstein's disease, and most importantly, our guest today, Jawad Arshad, CEO of Wow Health. Jawad, I really think that I believe that our viewers really got something out of that last episode with respect to a solution, and a solution that's a hybrid, something where your company is trying to meet the consumer where they are, provide the service, and provide them first dollar coverage, which is a term that many people appreciate in anything they get. So that was great. So I kind of want to expand on that in this block here. And as you mentioned, you provide some wonderful services with Wow Health, but some of our viewers out there might be saying, well, what else do you offer? I think I might be interested in this, but what else comes with it? What are some of my other options that Wow Health actually provides? And I want to touch on that because as we were talking before the show, you alluded to the fact that 93 or 94% of all incidents for health for anybody in our population take place outside of the four walls of a hospital. And that was the nexus for Wow Health for you in so many ways, because the consumer, as we've talked about with the problem and then into the solutions, you've addressed that. But there's also those incidents where people do need to go to the hospital. And when they go, there needs to be something there for them. And you can, if you would touch maybe just briefly on what those options are if they want to be just a Wow Health member, and that would be the first thing, and then we'll dive into your program that gets to every element of the necessity from outside the hospital to inside the hospital. So maybe you could just touch a little bit on something that has it's called a MEC. Maybe that would be something that would be added to Wow Health. In healthcare, there's so many different ways to discuss things to confuse people. It'd be great, because you did so well in the first two blocks, just to kind of share what that actually means and how it works, and then we'll move on to the more important stuff.
Yeah, absolutely, Greg. I think, so broadly speaking, when I think about what is the motivation, why did we kind of build Wow Health to bring access for healthcare? What we recognized is that 9 out of 10 healthcare events, 9 out of 10 times when people touch the healthcare system, especially under the age of 65, which is sort of our main target market, right? They are doing it in the outpatient setting. What that means is that it is outside the four walls of a hospital, right? They're going to a doctor's office, they're taking a blood pressure medication, they're getting some labs done, perhaps an X-ray, a mammogram, an MRI, maybe they're going to the dentist's office, right? All of these services, can be done outside the four walls of a hospital, so you can go to a local clinic or a local lab to get those done. And B, these services actually, you are a self-pay regardless if you do or don't have insurance, right? So if you didn't have insurance, well, then you're kind of on your own. You've got to figure that out. But even if you did have insurance, the terminologies we talked about, the copays, the deductibles, the co-insurances, when you put all of them together, about 8 weeks after your visit, you realize that, hey, I've just paid $250 for that office visit. Well, could I have paid a better, more transparent price at the time of service if I had told the doctor that I was going to pay them directly, right? And that sort of, I think, is the question that Wow Health addresses. And our proposition, of course, is that yes, and you can not only know what the total episode is going to cost, but you actually will almost always end up paying less in aggregate than if you would using a traditional insurance plan. I think
That's
fundamentally, Greg,
powerful.
I do want to touch on this, right? Because I think that what most of us don't recognize is that health insurance is the only insurance product where we expect that routine maintenance of our bodies, in this case, right, should be paid through product like insurance. Whereas if it comes to auto insurance or homeowners insurance, right, we recognize that maintenance care, that oil change, that tire rotation, your AC's tune-up, right, that maintenance care of whatever is being insured is actually being paid directly to the provider of service. And if there is a catastrophic event, then we are depending on that product, right, to protect us against financial ruin. In health insurance, because we've kind of muddied the water by bringing the routine, less expensive, but frequently used events with significant expensive inpatient care, right, and bringing them into that same uh, product, right, we've really, I think, twisted how that product is being used.
Jawad, what you just shared with the audience, the clarity of home maintenance, auto maintenance, and obviously having homeowners insurance and auto insurance versus healthcare, it's upside down. You took a look at what you do on a normal basis and said, why can't I have this with respect to my healthcare? That resonates. That is I guess in today's terminology, I guess we'd call that, or my kids would, probably yours, call that a mic drop. You got that one. And that really pushes towards that solution. You're providing the same thing that an automobile insurance company, a health insurance company would be given to the same people that are getting bills 3 months or 3 weeks later and finding added expenses. That doesn't happen with those insurance. Why should it with healthcare? That is I know all of our listeners out there, the millions of them that we have, they get that. That is a great way to frame that. Let's jump in this segment to what is offered through WOW if they wanted full what we would call in modern day comprehensive health care. Let's talk about that for a minute, because there are people out there that are going to say, yeah, that 95% I love, but I can't sleep at night because I'm worried about that 5. I know that's not the majority, but there's definitely people out there that have that mindset. Why don't you touch on that for us here as we continue this segment, Jawad?
Yeah, thanks, Greg. Yeah, absolutely. I mean, statistically, again, right, 5 to 7% of the events, especially for people under the age of 65, are going to fall into large medical needs, right? That's surgeries, pregnancy, perhaps, hospitalizations, right? Stuff that's really expensive, and realistically, no one can really pay for that out of pocket. So now you're kind of stuck, right? Because you either need to have a traditional insurance plan, you're thinking, or I'm going to be unprotected against those potential events and end up really sort of in a situation that may bring financial, right? And I think so this is where we know that just like any cottage industry, there are a lot of terms. You threw out one MEC, right? It's minimum essential coverage. This is a provision of the ACA, of the Affordable Care Act, that basically said, some services, some minimum services must be included in every insurance product. Okay, we can live with that. That's something that employers, not individuals, have, right? Another myth out there, and since I just mentioned that, is that some people still believe that it is required by the federal government for them to carry an insurance plan. Otherwise, they will get penalized. And of course, this particular provision was repealed many years ago, right? So, and still we will run into people who will say, well, if I don't carry an insurance plan, then I'll have to pay a penalty. And no, that's not true. That provision was repealed many years ago, right? So even if you are not carrying a traditional insurance product, you are not at risk for penalty from the IRS. Now, you alluded to the fact that, well, there are people who are going to say, well, okay, that's fine, that's good to hear, but what about the idea of us having some comprehensive coverage so that even if I do end up in the hospital, I am not going to be left without some protection, right? And so there are non-traditional products out there, something like a health share. You may hear another word called medical cost sharing, right? These are sort of community-based approaches. These are nonprofit organizations really coming out of the evangelical and Christian communities, right, where they're saying, we are going to pool together the resources of 10,000 people, 50,000 people, 5,000 people, right? And we're all going to put some money into a pot, and no one is going to touch that money unless one of us ends up in the hospital. So what they're fundamentally saying is, if you go see your doctor, if you go and take your blood pressure medication, if you go get an MRI, you're on your own. You're going to pay for that yourself. But if you end up inside the four walls of a hospital, then certainly we are going to assist you in paying those bills, right? Now that is sort of rudimentary as we speak about
Yeah,
it.
no,
But it has
that's
become very
yeah,
structured.
that makes
Right?
perfect sense, and it aligns to the fact that because 95% or more, some number around that, take place outside of the four walls, being able to have that coverage and know if you go, you're responsible for the first 2,500. But if something is sustainable over time, maybe you get cancer or something that requires added services beyond the year, unlike a traditional health insurance product, you don't have another deductible if it's the same event, which in the end is why it provides something that's a lot more stable to people, because they aren't looking at being diagnosed in December and then in January they have a whole new year and they've got another $30,000 deductible. That's a powerful element to the product. We're going to cut away for a commercial here, and we'll be back with Dr. Arshad here to close out the show. This is Greg Ehlers from Einstein's disease. We'll be back shortly. Thank you.